Hello everyone, you are welcome to my channel. Today we'll be discussing on how to breastfeed the right way. The discussion will take the following outline: introduction to breastfeeding, myths about breastfeeding, breastfeeding tips, preparing your nipples for breastfeeding, and lastly, breast care. So quickly, by virtue of introduction, we'll say that breastfeeding your baby is a loving, nurturing experience that strengthens the bond between you two. It carries on the physiological relationship that began when your baby was developing in your womb. Your baby knows your milk will be there when he or she needs it and trusts it to be pure and good. Because of this, some people say that breastfeeding is the first way to tell the truth to a baby and to keep a promise. To get started, hold your baby close to your own body with his or her head a little higher than his or her body. If you are sitting, keep your back straight. You may find it more comfortable to rest your baby on a pillow on your lap so that you are not holding all his or her weight until your baby learns to seek out or root for the nipple. Stimulate his or her rooting reflex by gently touching the cheek nearest you. He or she will instinctively turn his or her head towards your touch and so towards your nipple. Your nipple. There are some breastfeeding tips we need to talk about. Breastfeeding is simple. If it weren't, so many millions of infants and mothers wouldn't have managed it successfully. Some mothers do have problems getting started, though, so do ask for help from friends, nurses, midwives, and a league if you need to. So, here are some breastfeeding tips. 1. Establishing breastfeeding is always easier if you are able to put your baby to your breast within a few minutes of delivery. Once you've achieved successful suckling in the celebratory atmosphere that surrounds birth, you will feel confident about future feeding. If your nipple is soft and small and your baby has trouble finding it, put a cold, wet cloth on it for a moment. Your nipple will firm up and protrude. When you first start breastfeeding, your nipples will feel delicate. They need time to toughen up, so increase the length of time on each breast gradually. 2 minutes on each breast will give your baby sufficient colostrum at first. Build up the time on each breast to 10 minutes each side by the time the milk has come in on about the third or fourth day. All babies suck most strongly in the first 5 minutes, and during this time, they take about 80% of the feed. When he or she has had enough, the baby loses interest and begins to play with your breast or fall asleep. Alternate the breast you begin feeding with each time. Milk flows in both breasts at every nursing, and it's better to use both at each feed. Start with the heavier breast. We repeat ourselves. Please always start with the heavier breast. Once feeding is going well and your nipples have toughened up, let your baby suck for as long as he or she likes on the first side, so he or she gets both the fore milk and the hind milk. Fore milk is the dilute thirst quenching part. The hind milk is the richer, creamier part. Then switch to the other breast and let he or she stay there as long as he or she likes to. We move over to breast care at each feed. Start with the heavier breast. We repeat ourselves. Please always start with the heavier breast. Once feeding is going well and your nipples have toughened up, let your baby suck for as long as he or she likes on the first side, so he or she gets both the fore milk and the hind milk. Fore milk is the dilute thirst quenching part. The hind milk is the richer, creamier part. Then switch to the other breast and let he or she stay there as long as he or she likes to. We move over to breast care. How we can care for our breast. Your breast needs special care when you start breastfeeding. Buy at least 2 maternal bras, the best you can afford, and be very careful about the daily hygiene of your breast and nipples. Bath them every day with water. Don't use soap because it defats the skin and can encourage a sore or cracked nipple to develop. Always handle your breast with care. Never rub them dry. Always pat them. If you can, leave your nipples open to the air for a short time when you finished feeding. Wear pads inside your bra to soak up wear pads inside your bra to soak up any milk that may leak, and change these pads often. Don't leave a wet pad in contact with your breast for any length of time. To avoid cracked nipples, apply a drop of olive oil or hypericum calendocum cream to the pad. Leaking breasts can be embarrassing and uncomfortable, causing cracked nipples and staining your clothes. Replace your breast pads after each feed. Breast pads are easy to use, so soak them into the cups of your bra to soak off the leaking milk. Both washable and disposable pads are available, but avoid any any of the breast pad packed with plastic. If you have sore nipples at any point, use lotion to relieve the cracked or sore nipples. Apply often, especially after each feed. To reduce the risks, okay, quickly we'll move to myths about breastfeeding. We'll move over to myths about breastfeeding. But before then, we'll be talking about benefits of breastfeeding for your baby. Recent research has shown that the more physical contact babies have, the healthier and happier they become. Apart from the fact that breastfeeding also increases the bonding between a mother and the child and prevents babies from developing gastrointestinal diseases and other immunodeficiency diseases. Breastfeeding, the bonding that takes place during that moment also helps to keep the baby warm. You can appeal to your baby's sense of rhythm by rocking and swaying him or her. Skin to skin contact stimulates his or her senses of touch and smell and even helps him or her to grow. Human skin sends and receives warmth that has a positive effect on other human skins. Snuggling together will evoke a feeling of sensuous contentment. So, and then benefits to the mother. Breastfeeding is very economical and very safe, in the sense that when your baby is still breastfeeding and you have a function to attend, you don't need to start looking for what to take with you, loads of formulas and things like that. All you need to do is to get dressed, take your baby along, and you are good to go. When it's time the baby wants to breastfeed, you look for a place, a quiet place or somewhere private, you sit and you breastfeed your baby. You don't spend unnecessary money on formula, as those who, or women who do not like to breastfeed. Breastfeeding also helps with family planning, which is an advantage in the sense that the more you breastfeed your baby, you are not likely as a woman to get pregnant. And these are just some of the benefits of breastfeeding to both the mother and the baby. And then we move over to the myths about breast. Just look at some myths. We won't be able to discuss every single one of them because there are a lot of myths about breastfeeding. The first one